Occupational therapists are experts in assessing a person's ability to participate in their everyday activities, such as dressing, cooking, and driving. The Highway Traffic Act regulates the licensing of vehicles, traffic offenses, and other transport-related issues. And this legislation outlines occupational therapists' requirement for medical reporting to the Ministry of Transportation, so we created an OT driving working group to assess and report medically at-risk drivers.
We look at how a patient is processing information, how they react, are they able to respond to quick changes, their physical strength, and we do a visual ability screen as well. And then we think about how all of this information will impact their risk behind the wheel. And if it's determined that a patient is a medically at-risk driver and needs to be reported, speaking about alternative methods of transportation is something else we would do as OTs.
We developed education to provide a background on the legislation and then also develop a set of standardized tools with guidelines which indicate significant findings in function. We also developed a decision-making algorithm to navigate how and when to apply these tools. This legislative change recognizes that diagnosis is not the whole picture or the only way of identifying medically at-risk drivers. I'm proud to say OT now can part of the lead in these important conversations and decisions.
We welcome over 6,000 students to Unity Health Toronto every year. We are committed to providing a work environment that is free from discrimination, harassment, and violence for everyone, including students.
Some students do experience harassment, violence, or mistreatment. Historically, the majority of students didn't report these experiences, and when they did, they sought guidance from a variety of avenues that included their preceptor, the educational lead, and/or coordinator at the hospital or at their home educational institution. As an employer and placement site for students, we have a legislative obligation to ensure students are afforded the same protection as workers. The goal of this new process, which is being piloted at St. Michael's and will be shared across Unity Health, is to create an easy process that is consistent, productive, and supportive for students.
Student center staff, who are often the first point of contact with students, have been trained on how to manage and support students when they call, email, or present themselves in person.
As an education lead, I feel empowered by this process, and I know how to direct any student who may disclose an experience of harassment and discrimination. I know I won't have to figure out a solution to a complex issue on my own and without guidance.
This process supports an environment and culture that is intolerant of these unacceptable behaviors, while also improving the system for our students and future colleagues.
In the event of a mass casualty incident, many patients flood to the hospital for care. The amount of people looking for loved ones will be at least double the amount of patients that arrive.
A Family Information and Support Center, or a FISC, is a process that is implemented here in a critical situation to support searching family and friends, as well as to facilitate the reunification of patients and families whenever possible.
The FISC is staffed with social workers and spiritual care practitioners and security. I got involved with the FISC committee after participating in a simulation exercise where actors portrayed family members seeking their loved ones following a disastrous event.
Patient and family advisors, students, and community volunteers were essential in providing a critical lens on the care that they received. Security, volunteer services, admin assistance, patient experience, risk, and FISC leads from Sunnybrook, UHN were all invited to observe and share what we'd worked on and what did not work in the simulation.
The simulation team was critical to the design and delivery of this exercise.
Our committee has examined hours of the debrief recordings and written feedback, and we've implemented changes throughout our process. We have developed better resources for our staff, and we are currently in the middle of writing an e-learning module.
A very important tool that we use is to support patients to develop their own personalized crisis plan. This is the same benefit that I see in having a FISC. We plan for the worst so that we can provide the best possible support and minimize the negative impact for families.